My name is Catherine Giboin, president of the Médecins du Monde Foundation. Just like Jean-François has said earlier, we were created 10 years ago. The foundation has two main actions. First, support of feminist organizations, and support to operational research, and above all, dissemination and the use of research work for the fields that we're working on. And I believe it's really important for us to spend some time together, especially in the current context. We're going to talk about abortion. This is a topic that buzzed a lot this year because abortion was enshrined in the Constitution this year. You can ask questions live in the chat, but also here in the room. What I really wanted to say in this conference debate as an introduction, we're lucky because we'll have three different presentations that are extremely complementary in terms of the geography, in terms of the themes. As Sandrine was saying in her word of introduction, we talked about the three pillars that are research, operational advocacy, and operational research. And if we want to put a positive spin on women's rights, because I really wanted to be really optimistic at the beginning. 30 years ago to the date, there was the Beijing Conference on the Rights of Women. The bad news is that there hasn't been a new one because we were afraid of organizing a new one because we're afraid that we will backtrack. But since then, since 1995, a lot of countries have made their abortion countries more flexible. Only 4 have backtracked. Amongst them is the US, of course. We'll talk about a little bit more. Poland, El Salvador, and Panama. Was it Panama? Panama. Oh, no, it was Nicaragua, my bad. So a very quick presentation. We'll have 3 presentations with Kinga and Jelinska. I really practice my Polish accent, but I'm not sure I'm on point. She's created a Women Help Women, which is a women organization. They work on self-managed abortion. They're present in many countries. And Kinga will talk about Poland because they're also present there. But just so you know, to be fully transparent, Women Help Women is an organization that is supported by the Médecins du Monde Foundation. We also have Jeanne Hefez with us, who is policy and advocacy advisor at Ipas, or Ipas, rather. An American organization. Initially, it was based in the US, I believe. And that is now decentralized. My bad. Thank you. It is an organization that works on reproductive rights and access to abortion. They're present in many countries, so they work on SRMR. They've worked with MSF, MDM, to name a few. And we also have Raphaël, Perrin, Doctor of Sociology at University Paris, one member of the European Center for Sociology and Political Science. Raphaël has just finalized his thesis on abortion between 1975 and today, and he'll be talking about the key messages of his work in the light of today's theme. And let's promote his book. He's just published a book about abortion, on the choice to resort to abortion. It was actually released on Friday. So we'll start with the presentations. Each speaker will be talking about the research work that they've conducted and their work. And then we will have a debate. We will talk about the reflection in the post-truth populist environment, and I didn't want to talk about Trump. That was my goal today, but I think it's important to talk about it. Médecins du Monde has been taking a stance for years now on the right to abortion in all of our programs. And Médecins du Monde has been really mobilized since 2010 with partners, with the idea that, which is a fundamental idea, and I believe that all three presentations will clearly support this. This is a fundamental and legal aspect, but legal access does not guarantee effective and equal right to abortion. Italy is a good example of that, with there's a progressive law, but access to abortion was actually somewhat dismantled. I'm losing my papers, but I think what happened in Italy is a good example of how you can simply destroy access, all the while not really changing the law. And that's what they're trying to do. The Italian government said that they didn't want to change the law. Kinga?
Bonjour. Vous allez... la Pologne est le pays...
Poland is considered in Europe the country where you have the heaviest restrictions when it comes to abortion, and Malta, as well, alongside Malta. What's interesting in what you're doing in Poland is, and you will probably explain it to us, but please tell us how you've been able to implement a system for self-managed abortion with access to remote medical support, and it's changed access to abortion at a large scale. And what's important, what you've been able to implement, is the notion of network of feminist organizations. And I just wanted to know how you manage this, especially because this is extremely relevant in highly restrictive contexts. I'd like for you to tell us how you've been able to make self-managed abortion more professional, and how you've been able to do that in Poland.
Hi, I will be speaking in English. I hope that is okay. And since you mentioned laws, Catherine, allow me to start on a more general note. We gather here today for the Scientific Day, right? In recognition and in our respect and curiosity for science. So let me first state that all abortion laws are against science. They are against science, and they are against people who are pregnant. The current recommendation of the World Health Organization is to abandon any limits when it comes to pregnancy age, so to provide abortion throughout the whole pregnancy without asking for reasons, with plurality of models of provision, and legally fully decriminalize abortion. That is what holds scientifically and what we see from the data. So I'm asking you, where is this happening? Nowhere. There is no single country with abortion law that is actually according to scientific evidence or human rights standards. Yet we are so tied up to this idea of law as the victory, as the ultimate instrument to protect us and to protect abortion access. Let me be a killjoy again. Laws were always about politics. They were always about the trade-offs. They are simply deals. They are a political phantasm, yet the law became, in abortion programming, a fetish. It became some sort of a superego of abortion. Where the essence of abortion law, if we really look closely, is nearly always about exclusion and discrimination. It's determining whether somebody deserves an abortion or not, and most commonly it is done by telling us which reasons are better and which are the worst, or by how many weeks are we pregnant. It's a horror of a ticking clock, where from one day to another day, you lose ownership of your body. So let's also look that most liberal abortion laws in Europe in the 20th centuries came into force through the advocacy for organized medicines, right? When the doctor, the clinics, the hospitals were seen as the guarantor of safety. So institutionalized medicine took a monopoly on the practice and managed to criminalize everything that happens outside. And I happen to be an abortion provider that works in the movement that procures abortion outside of those conventional frames of law and of medicine, because those conventional laws and medical practices are straightforward outdated. And frankly, they are also unjust and quite stupid. So we work with abortion pill, a technology that is extremely safe, it's extremely effective, it's very well studied. Pills can be taken at home, usually with as little as possible interference with the formal system. This practice is called self-managed abortion and is a strategy of self-defense against criminalization and medicalization of abortion. We know from our experience and also from scientific evidence that when people take medicines at home with adequate support, it is equally safe and recommended as abortion in clinics. So my organization, Women Help Women, is an activist feminist organization that sends pills worldwide and supports community distribution of pills. We work particularly in countries where access is restricted by law or by stigma. And in Europe, as Catherine said, we take part in a larger network called Abortion Without Borders. And we became the biggest abortion provider for the whole country of Poland. Last year, we provided 47,000 abortions, mostly with pills. And sometimes later in the pregnancy, especially after 12 weeks, people are also supported to travel abroad, and we pay for it because abortions cost a lot. We counted. The Polish government currently owes us 15 million euro. This is how they saved money on us doing the work. And I will be provocative and ask you, do you really think that it's easier to get the pills in certain region of France or the Netherlands where I'm located than in Poland? I think it actually might be easier to get it in Poland. And with that, I invite you to question the very traditional assumption about quality of care and linking it to legalization, always. Because access to good abortion, as it was already said, and not the laws should be the main indicator when we talk about abortion. And good abortions can happen outside of the formal system. Very often those are even better abortions because the formal system is full of violence, obstetric violence, stigma, racism, and for many of us is simply unsafe. So once a scientist said, called Beverly Winikoff, in her presentation, something that really stuck with me forever. She said that those pills, abortion pills, have legs. Do you see the tiny legs? I do, and they have it. They came from me from Amsterdam in Thalys, and those pills also fit in the envelope and can be very easily emailed or mailed to people in need. So the legs, these invisible legs of pills and the mobility are really fundamental in the movement of self-managed abortion activism, again, around self-defense against systemic violence of the state. And with abortion pills, illegal abortions also became safe. So they are a game changer. In Poland now, there are many proposals to legalize abortion. There are drafts of bill, all of them with 12 weeks pregnancy limit as a cutoff. Irony is that actually we mostly need doctors and formal health system in the second, and third trimester of pregnancy. In the first trimester, we managed pretty well on our own. So once again, rationality, evidence, and proposed laws seem to be very much at odds. Our network, just as an opposite, advocated for decriminalization of abortion and those who help in abortion. Then we could navigate the trade-offs and with the government come up to the conclusion which abortions are going to be paid for and which not. And what was important is to make sure that all avenues of access that are safe and also demedicalized models will stay in the play. So the logic here was abundance, was diversity, was adding up models of care instead of streamlining and standardizing something into formal healthcare and giving abortion to gynecologists on a silver platter. Because abortion, again, is not a technological puzzle that is waiting for a missing element. We solved it a long time ago. It's not like with other fields of medicine where we are still looking for the cure and have to find it. We have invented and established surgical and medical methods. We have protocols. We have good standards of care. We have the research. The science, I would say, is rock solid. The abortion medicines are so safe, those medicines, that they could be sold in convenience stores, in supermarkets, gas stations, besides being available in clinics. Yet, they are not. Because abortion, according to me, is fundamentally about control. And control trades in power and trades in profit. And as an SRHR community, we feel comfortable saying that abortion is safe. We call it a right, a human right, a constitutional right, a choice, a cornerstone of freedom even. But when it really comes to make it rational, science-based, which would mean make it extremely easy to access, the discomfort starts. So we continue with this mindset that this is a luxury product and autonomy is conditional. We keep abortion overcomplicated, rationed, measured and duly controlled, counted, convoluted. We legitimize that way the mindset of scarcity and control. I would say that in 2025, we as a movement, we don't fear the procedure of abortion. We know that it is safe. We fear the ease of it. Thank you.
Merci Kinga sur cette présentation.
Thank you, Kinga, for this very dynamic presentation. There's one thing that I thought was really relevant when it comes to, especially when it comes to the scientific side of things. When you look at the political role that the WHO can have in technical protocols, because they produce protocols on abortion, and they've been doing so for a long time. I think the latest version dates back to 2022, if I'm correct. And these documents that are medical protocols also convey a clear political message. And it wasn't their role, and that's not how they presented it initially. And I don't think that they're even positioned on a decriminalization plan, but that's also what they do through their recommendation. Jeanne, you attended the Commission of Women's Status in New York a few weeks ago, the CSW. I guess it was a bit tense, especially given the current context in the US. You've been working on gender, anti-gender movements, especially in the US, and I thought it was important for you to share with us your knowledge, because I think that in France, we haven't fully understood the extent of these very organized heavily financed movements that have been thinking about these topics for a long time. And unlike what we tend to think about, they're not only American and only Russian movements, they're also present in Europe, and this is even more visible. And the current context, international context, allows them to be even more vocal than they used to be. And their agenda is more and more visible. So over to you, Jeanne. Thank you very much. As a quick story, Catherine and I met in an underground hallway at the UN, and I asked her to put a pearl necklace on and to spy on people here at the UN. Yes, but that's because also you're much more famous than I am. On 1st December 2024, the Spanish Senate organized the 4th Transatlantic Summit for the Political Values, which is one of the most conservative coalition in the world, most powerful coalition in the world. For 10 years, this platform has been working on dismantling the UN system on behalf of the defense of families, and they take decisions that would limit the rights of women and LGBT communities. PNLV is now a space for mobilization that is one of the most sophisticated ultra-right and extreme right groups. They're working through think tanks, political parties, NGOs, private Catholic groups, and Katalina Nova, former president of Hungary. She was replaced by José Cast from the far-right party in Chile. So they have a lot of influence. The Heritage Foundation also is very present. You may have heard of it because they initiated the 2020-2025 roadmap, which is an authoritarian roadmap that is used by Donald Trump. He uses it as an inspiration, but also as a guideline in order to dismantle the federal right, the suppression of LGBT and gender rights. And with Heritage, it's funny because they have a lot of influence across the Atlantic. You also have the Center for Fundamental Rights in Budapest, pro-Orban. They organized the Maker of Great Again conference not long ago. They're extremely active also in lobbying in Brussels. So in Madrid during this summit, pro-life and pro-freedom, there were over 400 decision makers from Europe, Latin America, Africa, America. It was the Argentinian cult Secretariat of State. In Argentina, you had Nicolas B., Vox in Spain, Italy, MP from Uganda, who's very well known for her work towards criminalization of gay rights, US MPs as well. And they've asked for the ratification of the Geneva Consensus or Geneva Convention, which is a Christian manifesto pro-sovereignty that was launched during the first Trump government, which is a cornerstone of the American diplomacy. It was ratified by 40 countries. Well done for Poland. Well done to Poland for withdrawing from it last month. And this manifesto is a space where conservative countries can network. Now, of course, this is not an actual convention. It was not signed in Geneva. There's no international consensus on it. But it does promote an alternative system on human rights, which we believe that under the Trump administration is going to be financed to be operationalized. This means that they're going to promote health systems for women that excludes abortion and sex education, and that promotes natural family planning. And in Madrid, during this summit, it was a 10-step declaration that was drafted that was pro-life, to defend life. 2 weeks later, in Washington, there was a limited group of decision makers that was invited by the Heritage Foundation from Latin America and Europe, Croatia, there was Chile, Argentina, and so on and so forth. And they were basically chaperoned by far-right figures to come up with national legislative action plans. The main targets that you can find is abortion of GPA, traditional abortion, and wokeism, and surrogacy and abortion. What's interesting is the method, the way that laws feed into one another, the values and the strategies and the know-how that are exported and that cross-fertilize one another. The alliance between organizations, far-right parties, maximize that network to link the global level to the national level to impose a restrictive Christian vision on sexuality and family values. So it's not just about a reaction to what we tend to call backlash, but here it's actually a movement that is institutionalized, that where a long-term vision, and where the Trump administration especially is currently being consolidated. And what we're seeing is the fruit born from over 50 years of dedication from these anti-right American groups, but also of their allies. And it's important to locate the U.S. in this historical arc, even though they have a lot of allies, and we'll go back to that later on. But when Roe v. Wade, when in 1973 abortion was made legal in the U.S., we saw organizations, medical, religious, and legal organizations that were created. What did these organizations do? Well, they created legal frameworks. They interfered in courts, and in 1984, their major success under Reagan was the global gag room law that restricted the financing for international organizations that would be working even remotely on abortion.
Donc, sous Reagan.
So under Reagan, who's capitalizing on the evangelist vote, we can see these associations and organizations becoming more and more important. They've got chapters all over the U.S. They are becoming real activists as well. They have speeches that are against women. They are defending the right of the fetus, the right of the embryonic state as well. And I think that what you need to understand is that the ambition of these evangelist groups here was not only to limit abortion rights in the U.S., but to limit abortion rights pretty much in the entire world. So we had feminists in the South as well, participating in the UN. So they're just have this space. We're saying that clandestine or illegal abortion is a huge factor of maternal death. So from that moment, the Vatican, it creates a real divide. And so this is when we are talking of the gender ideology. And so this is when we have this threat on gender.
Un outil de mobilisation.
And so this word is being used and is becoming a political instrument, and it's used by the far-right movement in the US. They will find allies in other conservative countries such as Libya and Iran and Egypt, but also in Europe, namely Russia and Malta. So with the help of the Vatican, they decide to unite and go against the UN. And so little bit what we can see is that we have an international lobby that was just created, completely obsessed with this idea of natural family concept. And so what's happening is that in the past 20 years, we've seen that offensives are becoming more and more numerous. We see an increased number of these type of coalitions, of these type of networks as well. We can see that we have massive investments in those, and we can see that there is sophistication and professionalization of their strategies. I mean, according to the European Parliamentary Forum study, we've seen that the anti-gender movement has quadrupled, so it was multiplied by 4 in Europe in the past few years. So even though the far-right U.S. movement has a huge impact. We have that in Spain, in Hungary, and in other countries in Europe. And so here the role of Russia is extremely important because Russia is funding activist movements that are against abortion, such as Citizen Go or a Family Congress, which is some sort of the emblem of these anti-gender movement. And maybe you remember back in 2019 when Giorgia Meloni has done her international coming out in Verona. Well, this was the Family Congress at the time. So these groups, what do? There is someone at the UN that has been speaking, and they use it as a distraction tool, as a mass distraction tool. And so the idea is to promote anti-democratic initiatives. So they are hindering negotiations, they're funding diplomats, and they're training them. There are a lot of American organizations that have subsidiaries in Europe, for example. And so, for example, the biggest US organization that has great power, they have offices in Vienna, for example, in Europe and elsewhere as well. You've seen that too. You've got 2 mega conferences. I mean, we see the link with MAGA, right? So they were organized in Brussels and in Madrid since the beginning of 2025. And of course, they inspire themselves from the pro-life activism in the US, but they also have bodyguards. They're doing pro-life protests. We also have some abortion clinics that are going through major crisis. So, for example, they implement a crisis that help vulnerable women, most precarious women that are pregnant and that are considering abortion. And so they offer free medical care if they decide to keep their babies. There are about 400 in Italy, but we also have some of them in Romania and in Hungary. And to finish, comprehensive sex education. I mean, of course, here we can see a link between these organizations. So, you know, with a movement for child protection, we've seen that with a Parents Vigilants in French, for example, and Éric Zemmour. So it's not surprising that the Manif pour tous is now a trade union for families, basically. And I'll just stop there. Thank you.
Merci Jeanne, je pense que tu m'as complètement sapé le moral.
I think what you destroyed any hope that I had, but thank you. I think it's it's terrifying to hear that, and saying that these anti-gender movements are professionalizing, they're using specific jargon, specific terms. I mean, they are working on their semantics, and hopefully someone can just cheer us up a little bit, Raphaël. Raphaël, you've done research and you've documented, all of the challenges when it comes to having access to abortion in France. So you talked about access inequalities that reflects also the other access inequalities that we have when it comes to the health system in France. So I think that's really interesting for you to be here today and share more of your work. Yes, indeed, in my work, my work is about access to abortion in a country in which it's legal, but the law is always evolving. For now, it's evolving in the right direction, as we made it easier to have access to abortion in France. But I decided to work on this paradox. We've been inheriting of this past 50 years during which access to abortion has been made easier. We extended the delay for abortion as well. We cancelled the mandatory consult with a psychologist. This is just an option. It's now optional since 2021. There was also a waiting delay that has now been cancelled as well. So the idea was, for foreign women, for example, to be able to have access to abortion and so on. So a lot of different things, a lot of different reforms were done to make access to abortion easier. But at the same time, so we do have this evolution, but we also have public reports. We have sociologists, ethnography experts, that talk about the struggles to have access to abortion, that sometimes it's a real combat. It's a real struggle to have access to it, that sometimes is a bit fuzzy as well, that there are also inequalities to abortion access in France. So what I'm trying to show here is that to understand that it's not only about, being focused or being interested in the evolution of the law. What's important is also to have a look at the activist movement in France up until now. We know that they have very limited impact on these challenges and struggles. So this partial inefficiency of access to abortion, it's important to have a look at the proper practices, what's happening in clinics, what's happening in the hospitals, and to talk with professionals that are not against abortion, but for some of them, for many different reasons, in the way that they practice medicine, they make it harder for women to have access to abortion, or at least harder than what is planned by the law. So what I've done is that I've been observing what was happening for 6 months in 3 different abortion centers. I've interviewed 140 abortion care professionals, and I also looked into statistics. And so one of the first things that I've observed is that even though access to abortion is meant to be equal for all women, the law says that women have the right to abortion, that this is a very easy medical procedure, there is no diagnosis, that doctors are basically here a service provider. However, it's not based on the women's decision, but on the doctor's decision. So who's asking for abortion and who's the service provider, who's the doctor? Depending on those 2 factors, abortion will be completely different. So women, for example, can have abortion extremely quickly in some centers with some doctors. For some it will take much longer. And here again, I'm talking only about doctors that are okay with practicing abortion. I'm not talking about those that do not want to practice here. So depending on how involved people are, depending on what their beliefs are, who the woman is, who the doctor is, the abortion access is going to be different. So some doctors that are really committed to that, we don't have the restriction of the waiting period. So as soon as of the first medical consult, the medication can be given, or they can also proceed to the vacuum procedure. So in some centers, some centers, they follow the law, they respect the law, and they offer that consult with a psychologist, and others are just imposing it to every woman, saying that this is part of the abortion journey. So some centers I went to, they suggested to some women, and not to some other women. So for example, if this is a woman who's getting a 3rd or a 4th abortion, that can be women, for example, that do not want to be using any contraception method, women, for example, that have several sexual partners, women that are crying. So, in some situation, nurses and doctors are going to say that this consult is actually mandatory. So another example here, when you can see that you've got some inequalities or differences in the way that people are being taken care of, or the way that things are being interpreted. Sometimes people are just interpreting the law. For example, you do have some sort of a room for maneuver for doctors. So, for example, early abortion. So women, for example, when they realize that they're pregnant, and they realize they're pregnant very, very early on, and they want to go through an abortion 2 or 3 weeks after being pregnant, the embryo cannot be seen during the ultrasound. And so depending on the doctor, you've got 2 different things. Most of them refuse to go through abortion if they don't see the embryo, because they're afraid so they're afraid for it to be an ectopic pregnancy, for example. So they invite the woman to come back later on. So we let the woman, go through with her pregnancy for a couple more days or a couple more weeks to make sure that we can go through with the ultrasound. And other doctors who think, that this is important to be able to abort as soon as possible, then they accept the request and they just ask for the women to do a blood sample 5 to 7 days after the abortion to make sure that everything's all right. But it's true that a vast majority are saying that, a lot of the women will not go through with that blood sample, and so they might just be roaming around with an ectopic pregnancy still. And so, of course, this would lead to health issues, to public health issues here. And, well, maybe before I stop talking, maybe one last example when it comes to, this notion of interpreting the laws. I was saying that creates huge inequalities. And I wasn't expecting this before I've done my research. So the delay up until when you have the right to abortion. The idea is not to talk about a legal delay, right? But how can we date a pregnancy? Because we say, the law says that we're able to have access to abortion up until 14 weeks, right? But it doesn't really explain how this is calculated. That could be the last date of sexual intercourse. That could be the last date of your period. So it would depend on a lot of different factors. But nowadays, what happens is that most doctors are basing themselves off of the ultrasound, which isn't really the best way to give the to give a date, right? So you measure the embryo. Depending on the size of the embryo, you're able to say how far along the woman is, right? But doctors here, depending on the room for maneuver that they're taking, they can decide to give a different date. So it depends on the technical choice made by that doctor. So 14 weeks in an abortion center, that could be 14 weeks plus 10 days in another center. And so, for example, this is now too late. So maybe the woman that wanted to go for an abortion, if she was living in another city, she might have been able to get that abortion that she wanted. So, I'm trying to explain why doctors have different practices and why sometimes their practice is making it harder for women to have access to abortion. And it's not because it goes against the law. It's just that, this is a real procedure and women have to be supported. And so it's important, for them, it means that it's important to have to be taken care of psychologically. And so this is something that was done in 1975, and it used to be mandatory. Now it's not, but those medical practices are just still there. And so it's why, doctors are not as progressive as we might think. So to improve access to abortion, we should not only focus on the law, but we should also focus on what's happening in the field, what's happening in abortion centers and abortion clinics.
Merci Raphaël. Et parmi les mythes.
Thank you, Raphaël. And, we were talking about myth earlier on regarding migration, but the myth also that we have is the number of abortion. The legal context doesn't really have any impact on the number of abortion that are, being done in countries. So the more restrictions you have, the more abortion you actually get. So it doesn't really have such a big influence. And I think, Raphaël, that what you're pointing out here is extremely important, because laws are sometimes extremely fuzzy or a bit messy. It's really hard to interpret them, or at least people can interpret the law the way they want, and we leave it to the doctors sometimes. And of course, this can lead to the issues that you've mentioned. It's actually quite depressing, I have to say. But I wanted to ask another round of questions now. Today I think that nowadays it's quite interesting to compare the situation in France with the situation in Poland. Kinga, you've said that you've been able to implement things in the Polish context, right? And to which extent, I know that you already do that in some other countries, but when we talked over the phone, you mentioned the example of Mexico and New Zealand. And so what you've been able to achieve in Poland, being able to scale up in Poland, to professionalize things, how could we replicate this in other contexts? or how can we not replicate this when we can imagine that this is, you know, something that could be done in countries where legislation is a bit more flexible or not?
Yeah, I think in terms of technology, it can be replicated everywhere. So it is a global movement for self-managed abortion and works in all the contexts, restrictive if not. I think the biggest potential of it we have seen in countries with restrictive access, just because those countries that theoretically have the liberal laws, which I would argue are all anti-abortion anyway, you know, did not pay attention, so to say. We see it now in the US, for example, that self-managed abortion is coming as one of the most prominent strategies of defense. But the truth is that it could have been practiced before. There was just no US money wanting to fund it. And I think in general, when I listen to Jeanne and to Raphaël, it really strikes me that, you know, really, it is not about science or technology. This seems to be some sort of a sick moral theater and a game of power and profit, right? And science, if anything, seems to be some sort of insignificant decoration in all it. So for me, it's challenging because it seems almost like, you know, in this theater, a dialogue or quality of arguments do not matter. What matters is elbows up and who has the lead role and even how to design the scenography of the stage altogether, right? So when I think of it, let me offer two reflection of, let's say, lessons learned and adaptable things from Poland that I think can be used elsewhere, and I particularly look from the perspective of winning sympathy of people and of social support, of common people. And to be honest, the one lesson that I have is to just own it. In the spirit, you cannot shame me for something I am not ashamed for, right? So, and for me, the social justice movements are always fascinating because I see them, they are different from politicians. They are supposed to speak power to the truth, right? They're supposed to speak about experience and realities, call things as they are in practice. We shouldn't shy away from the uncomfortable, we should not sanitize and euphemize or censor what abortion is or what our messages is for the sake of some digestibility. We're not politicians. We call bullshit, well, bullshit, right? So the abortion is about blood that is red and is with clots. It really doesn't look like the sanitary pads advertisements on TV with blue blood, right? There is no sense for me in pretending that abortion is always just a couple of cells. Well, guess what? It's not. It pretty much early on looks like a human-alike shape, or that abortion is not a termination of potential life. Well, yes, that is exactly what it is. It is a termination of potential life. So for me, the social change, as I saw it in Poland, and what worked for us came through defending those truths, through tensions, and through uncomfort. We cannot win abortion access if we ourselves have doubts and reservations or want to pinkwash abortion or call it a reproductive right only and avoid actually talking about its complexity, but also its easiness. And who really obstructs the game? And I think who obstructs the game are policymakers and doctors, predominantly nowadays. And by saying this and by practicing abortion in large quantities and being really proud of it, I think we made ourselves believable, and that help people trust us and support us because they don't see us only as, you know, a harm reduction strategy. They actually see us as a new voice that breaks in and sort of cuts the bullshit. Excuse me for the word again. So, example, on March 8 in Poland, in Warsaw, we took another step. We opened an abortion center that is colorful, that has a homey feeling. And where did we do it? We actually rented a place that is across from the parliament and across from the chancellery of president and main political party. It's like in their face. And they say that a lot of, you know, important decisions are taken on this street. So we said, why not? Then we come to this street as well. We are going to show you that the important decisions are also taken in the clinic. And the clinic is the center, as we call it, is different than a common imagination, right? White walls, everything sanitized. No, it looks homey. People come there with their own pills. They can do the abortion. There is a toilet, because most abortions happen in toilets, practically speaking. And they also can buy merch. They can buy T-shirts, and we count everything in abortion money. So if you buy a T-shirt, it's like half of cost of abortion pills. If you buy socks, it's 1/7, etc., etc. And maybe it speaks very badly of my character, but I must confess to you, I really take enormous pleasure in seeing the politicians that go to work, to the parliament, in front of our window, having to read abortion is normal, fuck for fun, or if you don't like abortion, please just don't have one. I invite them in and I say, please buy the socks, and then I announce that they donated 1/7 of abortion, right? So when it comes to political strategy, our thing has always been ask for the whole cake. You're gonna get breadcrumbs anyway only, right? And then when you get breadcrumbs, also have the courage and mental sanity to call it that it's only breadcrumbs and it's not good enough. And last thing on lessons learned that I think is also scalable and adaptable to all contexts. And I think it's also to the context of Jeanne, right? That we are often put in these fake binaries, right? Where abortion becomes some sort of debate, where there is pro-life and pro-abortion people. And we challenge that narrative a lot. We say abortion is not a moral debate. It is a fact of life. It's a matter of experience. The experts on abortion are not the lawyers, I'm sorry, lawyers in the room, are not only the doctors, but are people who actually have had the lived experience of having abortions or supporting others. So we, the human rights activists, are not in binary opposite of the pro-lifers. We use evidence, science, human rights standards, and it does pay off to call out on for example, the media, on putting us all the time in this binary. We say, no, we don't agree on this, or we require to deconstruct this myth. The other binary that's also very often seen in debate and even in some laws is like the rights of the pregnant person versus the rights of fetus, right? This agenda is coming more and more everywhere, and I agree that it's one of the strongest anti-abortion agendas. And it's not even about, you know, the beautiful babies, the pink babies, and the whole imaginations as we've seen it, but it's more sneaky. It's about debates over personhood and pain of fetus. It's about gestational limits, right? And trying to lower down, no, 14 weeks is too much, come on. You could have thought within 12 weeks, right? If you had so all these kind of arguments that are very much against women and against specifically later pregnancies.
I'll keep the just own it slogan. I like it. So I'll definitely just own it. This is my new slogan. Jeanne. Associations for SRHR, I think they're all, you know, in the same situation. They're all depressed. We've already said that. Can you tell us a bit more about your vision, you know, through the lens of the US? I mean, what's happening regarding the civil society, feminist civil society? What can we do exactly? I think that Kinga should have talked at the end of the panel, because I'm going to go back on something a bit darker. So I'm going to kill the hope. You know that, but in the past 3 months, this is a real tsunami We keep on repeating it because we have to say that. We are completely under shock. Nothing could have prepared us to that cruelty, to the violence that we're faced with. We have decrees, being slammed on us every single day. Over 50 decrees have been signed, and it just completely destroys and dismantles everything that was done in social justice, environmental justice, racial justice, and fight against discrimination. We've never seen that before. We've never seen the far right and Christian organization being all working together and holding people's health hostage. We knew that 2025 would be a very difficult year for the US, and it would have major consequences on the rest of the world, but we could have never imagined the impact it has. At the national level, well, last week the admin has decreased the funding for Planned Parenthood clinics, and it is now being discussed for Planned Parenthood not to be reimbursed. And there would be no subsidies whatsoever, which means that American people would have pretty much no access to family planning. Also, this is under the Trump's mandate that we've seen 3 conservative judges being appointed. And so we know that they now have the majority. This is with this majority that we've seen the Roe v. Wade amendment being overthrown. And so now we've got most of the states in the U.S. 14 states, where abortion is completely illegal. And we went from about 20 clinics to 0 clinics whatsoever. There are 7 states in which, for example, abortion is illegal after 6 weeks. And we've got entire region, I'm thinking of the southwest of the US, where there's no states, basically, where we have no restrictions. So we've got states and regions that are, transforming into abortion deserts, as we call it. So now that all of the humanitarian aid was completely frozen with the America First policies that were 10 days ago, the State Secretary Marco Rubio has announced the shutting down of U.S. aid. So it's no longer an independent agency. This will be part of the government. This represents 60 billion dollars of aid that is no longer here. All of the employees from national offices were fired overnight. So this goes against the labor code, of course. And in the context that we're in, the U.S. is the biggest donor when it comes to family planning. If we add all of the cuts that were done, it is estimated by Goodmaker and other partners that
qui entraînerait 17 millions de grossesses non désirées.
That 17 million unplanned pregnancies will happen, and many women will die because of that. Also, we are still waiting on the guideline specifications. So according to 2025 project, this will be extended to any financial flows, to any money coming out of the US, which means that bilateral agreements, for example, with government. So the freeze of foreign aid, this is a political attack. And it's all based on an ideology. They're no longer part of the WHO. It's no longer part of the Human Rights Council. We've seen that the emergency plan to fight against HIV has come to a stop as well. Then Gavi was also announced last week, and we know that SRHR, LGBTQAI+, and all of the words that can no longer be used. We've seen how big of an impact this had. So, for example, the UNICEF, the main donor is the US. So here we have the same pressure. That is to say that they're expected to change all of their internal organization. We also have the promotion of a Christian diplomacy. So they're all about nativity. And so now all of the funds will be given to organizations working for Christian values. So last week, there was a meeting in between the Trump admin and the CDC. So this was the very first time since the budget cuts. And so this time, the admin was very clear. They had the audacity to announce their priorities, that is to say, promote food and vaccine exports, constructing facility only through American companies, and giving more importance to the fight against terrorism, and funds towards the military. So within the 40 contracts that were put to a stop, only 8 are being maintained for Yemen, Afghanistan, Ukraine, and Haiti, and some other countries. Unfortunately, the EU is remaining silent, and it seems that they're also reviewing their budget. We're talking about austerity, we're talking about competitivity. And so what we've been able to observe here is that some language elements are using the words that we hear in the US when it comes to the importance of aid. We hear about gender as well. But we can see similar narratives that are being used in Europe now. We can see that in Sweden, in the Netherlands, and most recently, specifically. And so in France, if there is no subsidies allocated or no funds allocated, I mean, you've seen that the APD, for example, was undergoing some budget cuts. And so, of course, this will be useless if we don't have any funds. And we're doing a lot of advocacy work with MDM at the government level. So very quickly, when it comes to what we're faced with, I mean, we are going towards sanitary issues, multiple pandemics as well. So I think it's important to try and fight as much as we can to try and avoid as many deaths as possible. So the EU has to start implementing new initiatives and programs. We need to support feminist organizations working in the field because they're the first one to be impacted by these budget cuts. And as Kinga said that, because this is one of the most positive things that we've heard today, in the US, in Latin America, in Africa, in Poland, in Europe, there are organizations that are doing incredible work in the field, that are organizing, abortion clinics, that they're doing a lot of work, and they're giving access to the most marginalized people. So we need to support them, we need to make it sustainable as much as possible, and we need to support these networks.
Merci, Jeanne. Merci, Jeanne.
Thank you, Jeanne. Thank you for trying to give us some hope. So now if we go back to what is happening in France, enshrining abortion in the Constitution. Regarding the work that you've done, what do you imagine when it comes to the next leads? I mean, what can we change in the upcoming years, seeing the depressing context that we're in? What can we do in a country where abortion is already legal? Well, to answer this question, I think that there are two things that we need to avoid. So the first is the vision shared by shared with the government, which is the glorification of this entire situation. We've been trading the constitution, we're the country of Simonville, and so on and so on. So we need to think about how efficient the right to abortion is. And the second vision is quite different. So this is the one focused on the fear of losing access to abortion. And so we're only talking about having access to abortion or not. And we don't consider that all abortions are different. It's not only about having access to abortion, but actually the type of right that you want. And I think this is pretty much what we need to discuss about, or this is what we should, this is the type of questions that we should raise. We need to be ambitious. And so if you do that, there are, several room for there is room for improvement here. There are several things that we can do. There are things that we can improve in the law. We talked about the legal delay for abortion that is not as long in France as in other European countries. For example, in Spain, in the UK, and in the Netherlands, we can have an abortion 2 months later than what we can have in France. So there are countries in the EU that are much more progressive. Or at least we could have a debate on that question. The delay that is given for now, it's not different in women. It's just a political decision that was made at some point in time. And this is meant to be a balance in between the bodily autonomy that we're giving to women and the age of the fetus. Kinga, as you were saying, what hinders abortion is basically healthcare professionals and law. But, in a country where practices are more restrictive than the law, well, the law can also be some sort of a safekeeper, against health professionals that might decide not to give access to abortion. For example, it's enshrined in the law that women can choose the type of abortion that they want to have. And we could put this in the law, for example, that women can have access at the first consult. So this is, something that women could use or could use as an argument to have access to abortion. So we can play on this legal dimension. Then we can also say something about the funds. We're talking about, for example, maternity wards that are being shut down. For example, difficulties to find doctors or midwives that would accept to proceed to an abortion. So maybe to give you a couple examples, I think that if we act on medical practices, we could improve the situation without even spending €1 for public health. For example, in medical deserts where women have to drive for 50 kilometers in order to find an abortion clinic. The fact that we ask them to come back 3 to 4 times to get an abortion, though it could be done in just one consult, of course it multiplies the distance that they have to cover. So here this would be something very simple to improve. If women could just have access to an abortion as soon as the first consult, this would make it even less expensive for the health system. Now, when it comes to the most precarious women, when it comes to access to abortion, the problem that we have is interpreting. In all of the centers that I've visited, there is absolutely no interpreters whatsoever, which is terrible for migrant women. Nothing is being explained to them when it comes to the type of abortion they can go through, when it comes to contraception. For example, an implant was given to a woman. She had to go through surgery for an implant that she had no idea, what she was going through exactly. So there was no interpreting whatsoever. At some point, there was some interpreting over the phone, but it wasn't just properly working. They were not used to using it. It takes about 5 to 10 minutes before you get an interpreter on the other side of the line. And so, people just rather not explain that they have access to over the phone interpreting, or they'd rather just use an app to try and do that consult. And then I think that it's important to also explain the abortion journey to women, so encouraging maybe for women to have access to abortion as soon as of the first consult. It would be nice also to try and make it easier to do consults online. So at some point, there was a system that was implemented that was meant to monitor what women were doing. You know, when it was created back in the 70s, and so I think we could keep on dismantling this system and try and get another system for access to abortion. So, for example, having an access that is not only in the medical sphere. For example, you can have access to the abortion pill at the pharmacy for some women, and for other women who would like to be supported medically, that would want to see a social worker, see a psychologist. We should definitely also have this type of service.
Réel des femmes.
Merci pour ces recommandations très pratico-pratiques, et à la fois sur la dimension légale et à la fois sur la dimension de l'accès et la réalité. Alors, on a épuisé notre temps, mais vous n'avez pas faim du tout, en fait. Non. Vous avez des questions? Donc oui. La seule question que j'ai dans le chat, c'est en fait une remarque, donc ça vous laisse le temps de réfléchir. Ah, j'ai une question. Donc, alors, j'ai un premier commentaire sur Kinga, qui dit « Merci pour avoir dit que le contrôle de l'avortement, c'est du pouvoir et des bénéfices. Merci Kinga. » Une question pour Raphaël. Quels ont été les apports de l'accès de prescription de l'avortement par les sages-femmes? Les femmes attendent-elles moins? Les choix sont plus restreints. Et une autre question pour Jeanne, je dis les deux. Concernant les différentes rencontres des mouvements d'extrême droite dont vous avez parlé, comment obtenez-vous les informations diffusées lors de ces temps? Est-ce que tout est diffusé sur les réseaux? Qui commence, Raphaël ou Jeanne?
Allez, j'y vais.
Allez, vas-y, oui.
Si ça te va. Les sages-femmes, c'est effectivement donc les sages-femmes peuvent pratiquer l'IVG médicamenteuse depuis 2016 et instrumentale depuis 2022 sous un certain nombre de conditions réglementaires et de formation des sages-femmes. Ça permet effectivement un accès à plus de possibilités de trouver des professionnels de santé, en particulier dans les déserts médicaux. Ça ne résout pas tout le problème, notamment parce qu'il y a presque tout autant une pénurie de sages-femmes que de médecins. Donc même les maternités pour le suivi de grossesse, l'obstétrique, manquent de sages-femmes. Donc ça ne résout pas tout. Et les pratiques des sages-femmes ne sont pas forcément différentes de celles que j'ai soulignées des médecins. Il y a la même question de variation des pratiques et parfois de complications des parcours. Tout de même, les sages-femmes en libéral, parce qu'elles définissent beaucoup leur identité et leur rôle professionnel, aussi en opposition à celle des gynécologues qui seraient, en tout cas en se positionnant dans la dénonciation des violences gynécologiques, la dénonciation du paternalisme médical, qui se positionnent comme des soignantes bienveillantes et qui font des consultations plus longues en faisant plus attention à la question du consentement parfois, et ont globalement des pratiques qui sont un peu plus à l'avantage dans le sens de l'autonomie des femmes en libéral, parce que c'est aussi pour en parler, il y a presque un créneau professionnel en fait pour les sages-femmes de se positionner comme les gynécos, faire de la gynécologie bienveillante, parce qu'elles n'ont pas la même légitimité technique que les gynécologues, donc elles investissent plus ce plan-là avec des effets très concrets. Les sages-femmes qui le font à l'hôpital, dans les centres d'IVG, dans les cas que j'ai vus, ont des pratiques absolument identiques à celles des médecins, parce qu'il y a aussi un enjeu à justifier le fait que les médecins les ont acceptés dans l'équipe, et donc elles sont les bonnes élèves des pratiques du service en fait quelque part. Donc voilà, l'accès des sages-femmes à la pratique de l'IVG, ça crée plus d'offres médicales avec un effet restreint mais réel. Sur les pratiques, c'est un peu plus mitigé.
Jeanne?
Bon, on est diffusé en ligne, non? Donc je vais rester très large et évasive sur la question.
Rendez-vous au café.
Déjà, je pense qu'il y a beaucoup de ce contenu qui est effectivement public, qui est en ligne. Beaucoup de ces conférences sont retransmises à la portée de tous et de toutes. Ce que je trouve fascinant avec certains parlementaires, notamment européens comme Marion Maréchal Le Pen, c'est la façon dont ils parlent quand ils sont au Parlement européen et la façon dont ils parlent en France. Il y a une vraie différence de radicalité dans les discours qui sont tenus à Bruxelles. Ces conférences, elles sont accessibles en ligne. Pour le reste, c'est de la recherche et on a différentes méthodologies. Vous pourrez m'écrire après si ça vous intéresse d'en savoir plus. On a beaucoup de rapports en ligne, en tout cas, qui montrent et qui donnent accès à beaucoup des chiffres et de l'analyse dont j'ai parlé.
Merci. Alors, on me fait signe que non, que vous avez faim. Je vous propose peut-être d'arrêter là pour ne pas entamer le calendrier de la journée, enfin le timing de la journée. Les intervenants sont présents et si vous pouvez aussi poser des questions dans les temps de pause, y compris de déjeuner. Merci à vous trois pour ces présentations.